We have Dr. Webb, a spinal surgeon from San Antonio, Texas. He makes great YouTube videos and he's a huge inspirational speaker. And we're so happy to have you speak today.
Yeah, thank you. I appreciate it. I'm gonna go ahead and share my screen.
You should be able to share your screen, I believe.
All right, can you guys see that there?
Yes, we can see it.
All right, we'll get started. So like you said, I'm an orthopedic spine surgeon, private practice here in San Antonio. Kind of my interests are minimally invasive spine surgery, robotics, computer navigation, as well as artificial disc replacement. In terms of my educational background, I went to college here in San Antonio, went to medical school at Georgetown, did my residency at UT Health San Antonio, and then a spine fellowship, which was a neurosurgery, orthopedic surgery combined fellowship at Texas Back. I'm originally from Shreveport, Louisiana. That's where I grew up and went to high school. These are kind of my two best friends here. The guy to my left, he's a cardiothoracic anesthesiologist. And my other friend here, he's a personal trainer. So we all kind of did something in the medical field. But it wasn't until this magnet program called the Fairport Medical Careers Magnet Program that got me interested in medicine. And it's because of that program, and that's the reason why I'm a doctor today. But I was never the perfect kid. You know, I got into a lot of trouble growing up. And even at one point, I contemplated dropping out of high school. I made it all the way to my principal's office, and my father, who was a security guard at the school, he met me in the principal's office, and the principal looked at me and she said, "Hey, I heard you verbalized wanting to drop out of school. Are you sure you want to do that?" And I looked over at my dad, and my dad had tears coming down of his eyes. And before that, I'd never seen my dad cry. So I decided to stay in school, and I'm glad I did. But still getting into trouble. The people that I looked up to were the dope boys, the drug dealers, the people who had all the money and flashy cars kind of growing up. But just the type of environment, Louisiana, it is the world's prison capital. It actually incarcerates more people than any other kind of state in the U.S. And at one point, Shreveport was the 12th most dangerous state in the U.S. So if you think about the prison system, I found this to be very common in Shreveport, where it's like a hamster's wheel. You know, people going in and out of prison, and then they get out and then go back in prison. So I saw this to be very true, even with my close family members. My dad, when he was younger, he spent time in jail. He joined a gang, so drugs. My little sister did time in prison. My little brother was sentenced to a juvenile life sentence for armed robbery. And then ever since I've been young, my mom has been on and off drugs and in and out of jail my whole life. So that's the type of environment that I grew up in. And at one point, there were 3 out of 6 members of my family in prison at the same time, all for different reasons. A few years ago, my mom was actually shot, and she's actually paralyzed from her waist down due to her drug addiction. So, you know, just being in that type of environment and just getting to where I'm at today, I'm just really blessed. So my greatest fear growing up was that I would become a statistic. Like I said, several close family members who kind of fell victim to the streets. And but I kind of made a little promise to myself that I would stay out of trouble and stick to the books ever since that magnet program that I went to. So I get asked all the time, like, hey, how did you avoid being a statistic, you know, growing up, where your friends and family members were, you know, going to jail and getting into trouble? Well, it was my dad. My dad turned his life around and became a minister. I remember going out into the streets of Louisiana. We would hand out food and we would minister to the homeless people. So that act of altruism kind of stuck with me. And it was this Fairport Medical Careers Magnet program that just gave me that vision that it was something that was possible, because a long time ago, you know, I didn't know about YouTube or just go online and kind of search different career options. It just wasn't available. So I kind of looked up to people that were kind of around me. And also my big brother, he's a role model to me and kind of an inspiration. He's active duty Army. Actually just got stationed or moved to station in North Carolina. So I actually joined the Air Force at 17. I spent 8 years in the Air Force. I did it 5 months in Iraq as a medic in 2005, north of Baghdad. But the whole time I was in the military, I went to school at nighttime, weekends, internet courses, and it took me 7 years to get my undergraduate degree just because I kept having to drop classes, military obligations and responsibilities. And then I went to I believe it was actually 5 different schools. So I would take classes wherever and whenever I could. So I would take a class like on the weekend at one school, take a night course at another school, whatever, could fit in my schedule. And that's exactly what I had to do to get through college. So these are just pics. When we were in Iraq, we did have to take guard duty and kind of guard our camp. And then this is a picture on your right here. We were loading a wounded soldier onto the chopper here. So they would injure themselves or get injured, and then we would stabilize them, and then they would ship him on this chopper here over to Baghdad, and then out of country to Germany, hopefully within 24 hours. So this is kind of our camp, and this is where we worked out of here. These are tents. This is our hospital right here. We had a triage area in the ER up front. We had an ICU. We had a area for patients who were kind of stable. We had an operating room kind of back here. We had a CT scan. So when we go anywhere in the world, the team that I was on, we can go anywhere and set up this fully functional hospital within 24 hours. So this is where I worked at for 4 or 5 months. And this little bunker here, this is where we would go into just as protection when they shot at us. So I went to a base or area called Mortarville just because we got shot at maybe 4 or 5, sometimes 6, 7 times per day by rockets and grenades. But this is what the inside of the hospital looks like. And most of these patients here were Iraqi patients. This patient had a fracture in his leg, I believe some type of blast injury. This patient here has a trach, which is a breathing tube that goes into your throat. So all different types of mangled extremities, gunshot wounds to the chest, you name it, we saw it while we were there. This is over Baghdad here, and then this picture to your right here, these are the people that kind of kept us safe while we were there. So they would stay above us and then take care of anything that was kind of coming towards us. So these are snipers that are up here, and that's what they did. That's their job over in Iraq. And the enemy, it wasn't too far away. This gate here was the really only thing that kind of separated us from this little village over here. And these are the things that they shot at us, rocket-propelled grenades and mortars. And there's actually one day where I was taking care of a wounded soldier, and I just heard a big go over my head and hit the ground. I was like, what the hell was that? So we went outside and found out that they actually got really close to hitting us. This grenade actually went right over my head and hit the ground, but luckily it didn't go off. It was called a dud, which means it just didn't explode for some reason. Otherwise, I would not. That grenade would have probably took out our whole camp. So luckily it didn't go off, and there's a couple other close calls that while we were there. But this was probably day number, man, it had to be within the first week we were there. So whenever I talk to students, I always talk to them about the paths. So a lot of students want to become doctors, but you really have to understand that there's multiple paths to get to your goal. So I always tell the student, my best friend and I, who we've been friends since middle school. He's the cardiothoracic anesthesiologist. So in high school one day, he came up to me. He said, "Hey man, let's go to college together." And I was like, I don't know about that. I need to get out of Shreveport, man. I'm getting in too much trouble. And he said, well, I'm going to go to college. And I told him that I was going to go into the military. So I went into the military, and I did 8 years right out of high school. And then I went to college while I was in the military, and then got out, went to medical school. So he went straight to college, straight to residency, straight to fellowship. And then he joined the military, and then he did 6 years, the time that you have to owe back. And then he finished his military time, and now he's private practice in Alaska. So we're both private practice, we're both physicians. We just took 2 separate paths to reach our goal. So, the student next to you is doing one thing, or taking a year off, a gap year, or, wants to go travel the world for 2 years, it doesn't mean that you have to do that, or, you have to go straight to medical school. There's so many different paths to become doctors. So these are all the medical related jobs that I have had to become a spine surgeon. I was an EMT, I was a critical care technician, I was an LVN, medical student, orthopedic surgeon, and then spine surgeon. So my path I got out the military in 2007. I applied to medical school. It took me 3 years to actually get in. And actually, I didn't get in. I got into a post-bac program, and that's the reason why I got into medical school. So each year, rejection letter after rejection letter after rejection letter came in. And this is one of the schools here. So this was 2009 that I would have started. They told me I wasn't a good fit for their institution. I won't kind of mention the school's name, but I kind of keep this and use it as motivation and kind of look back at it. But these are some other schools that I applied to. They sent me rejection letters. You see here at Tulane, 2009 and 2010. And the funny thing about this is that even though these schools, when I was applying to medical school, they rejected me, but when I was applying for residency, Tulane was actually the program that was recruiting me the heaviest. So they really wanted me to go there, and I thought that was pretty hilarious. And I was like, wow, you guys rejected me to your medical school, but as a resident, you guys want me to come to your residency program. So, if you don't get your top choice of medical school or residency, say for instance, you want to go to Stanford, you can go there for fellowship, and still say you're Stanford trained. So just never lose kind of sight of that. So I actually was toying around with different programs. Hey, what can I do to strengthen my application? And then most of the medical schools that I contacted that review my application, they suggested that I do a post-bac program. So that's exactly what I did. Went to Georgetown to do that post-bac program and did really well in the program and got into medical school there. So as you guys know, medical school is 4 years long. It's really competitive. The first 2 years are in the classroom. Years 3 and 4 are in the hospital, but there are some schools that allow you to do clinical rotations kind of early on in your first year and second year. And then my 4th year, I was able to go to Liberia, West Africa. I went to a hospital called JFK Hospital. I was there doing emergency medicine and general surgery. This is just a picture. I thought this was really impressive that you can kind of balance that. This is some of the food that we ate here. Right outside the surgical ward. This is one of the anesthesia machines here, and I was just taken aback by that they were still using it's an anesthetic gas called halothane, which we don't really use here in the U.S. But it's a cheap gas that's very accessible, and that's what they were using to put their patients to sleep. But these are some of the residents that there was a general surgery residency there. There was a orthopedic surgery residency. And we were rounding at the hospital on the patient here. This is the operating room here. And then this, to your right, is the ER. So this patient here had a diabetic foot ulcer that from uncontrolled diabetes. And then, that affects your bone and your skin, and you can get infected and you lose your leg. This patient back here had tuberculosis. So this is their ER. Saw all types of different conditions and things that you probably wouldn't see here in the U.S. or to this extent. A big mass on the back of this little kid's head, things like that you just won't see. I was able to go to some of the schools and give some talks. So yeah, I had a good time there until I was walking around the hospital one day, and people were kind of freaking out, and they were kind of being, just really nervous about something. And I was like, what are you guys where's everybody kind of on the edge for? And it was like, Ebola's coming, Ebola's coming. I was like, what is Ebola? So I had no idea what that was. I didn't know that until we got into country. And luckily my medical school has kind of stayed the duration of the month that we were there. So, but the CDC and World Health Organization came over to give us a talk to the hospital staff, how to don your gloves, your gown, how to put on your personal protective attire. So, it's pretty funny that, years later, so this was 2014, 6 years later, we're dealing with a coronavirus, which is, devastating kind of virus, but, Ebola kind of wiped out Liberia. This is one of the ER doctors that I worked with when I was there. And then a few weeks after I got home, I found out that he passed away from Ebola, as well as Dr. Bora Bor. He was the chief medical officer. He's an internal medicine physician as well. And then a couple of the residents that I work with. So I was really lucky to just escape that and make it back to the U.S. Right before that kind of kicked off. So residency, you apply during your 4th year. This can range from anywhere between 3 to 8 years, lots of different specialties that you go into. But being a resident, it means to reside. So you're gonna reside at the hospital. You're gonna spend a lot of time at the hospital, and you're gonna spend a lot of time, probably more time at the hospital than you will spend with your own family. So there are some weeks where I would spend more time with my co-resident than I would see my family. So that's just the nature of it. But you're gonna be very busy. But on the flip side, once you get done with all your training, you get compensated really well. I would say these numbers here, there's lots of different ways you can earn money as a physician. But if you're in private practice and you have a lot of investment opportunities as well as partnership opportunities and ancillary income, you can probably double or triple this very easily. So one of my professors in medical school, he gave us a lecture one day, and he said, hey, when you're thinking about choosing a residency, you want to think about 4 things. You want to think about money, you want to think about passion, lifestyle, or prestige. And if you say, for instance, you want to make a lot of money, well, go into neurosurgery, or go into orthopedic surgery, spine surgery, plastic surgery. But your lifestyle may be affected by that. So it's a give and a take. But if you go into something like pediatrics, something that you say, for instance, you're passionate about adolescent health, you go into pediatrics, well, the money may not be there, but the lifestyle, you may have a better lifestyle. So you have to figure out what's most important to you. A key thing about the match process, for those who don't know, the match process is during your 4th year of medical school, where you apply to different residency programs, and then you interview. And then after the interviews, you rank the programs that you want to go to. Say, for instance, you did 10 interviews, and then you list those from 1 to 10 to a computer system. And then the residency programs will list the applicants that they interviewed in a list. Say, for instance, they interviewed 30 students. They will list them from 1 to, let's say, 25. Maybe they didn't want to rank 5 students. So if you match up, you put Tulane #1, they put you within their top 6, and that's a match there, and that's where you do your residency. Well, how do you do well in the match process? This is something that I think is probably the most important things to think about. #1 is your step 1 score, and this may change in the next few years as step 1 goes to pass-fail, but right now the most important thing is your step 1 score. The second most important thing that I think is your away rotations, and this is a way to get your foot in the door. This is a way to get people to know you. This is a way to really shine. And I matched at my #1 choice. I went on 15 interviews, 14 or 15, and I matched at my #1 choice in UT San Antonio. And I strongly believe that they ranked me so highly, and I ranked them so highly, is because I spent a month there, just rotating, getting to know the residents, doing surgeries, working my butt off. And by the end of that rotation, it was like, man, we need to keep you around. So that's how you get your foot in the door. Compare that to, let's say there's 200 people that apply to UT San Antonio. Well, how do you differentiate yourself from the 200 other people if you all have, everyone's competitive, 240, 250 on your step 1 score? How do you make yourself stand out? Well, the way to do that is to rotate there and work your butt off during that month. So I think that's one of the most important things is your step 1 score, away rotations. Clinical grades are important as well. Say, for instance, you want to go into dermatology. Well, during your rotations, you have to honor those. You have to high pass or make A's, whatever grading scale. If you want to go into orthopedic surgery, you have to do well in internal medicine. You have to do well in general surgery. You have to do well in orthopedic surgery. They look at all of those rotations. And then after your clinical rotations, you get an evaluation from your preceptor. So they will write, hey, student John Doe did well this rotation. This is what I liked about him, and blah, blah, blah. And all of those evaluations get put at the front of your application. So clinical grades, your evaluations, they read those. Those are important. Make sure you do well. Letters of recommendation, yeah. And then research is important, but not required. But it will help you, stand out or kind of differentiate your application from another student. So this is a little chart that I saw online that I thought was really helpful. So if you don't know what you want to go into, so you just ask yourself, hey, how are your grades? If your grades are just okay, you ask yourself, hey, are you a huge nerd? If you say yes, you can go into pathology. If your grades are just, mediocre, but well, do you like people? No, go into pathology. If you like people, are you willing to touch them? No, go into psychiatry. If yes, go into PMR. What do you think about kids? If you love them, go into pediatrics. If you think they smell, how do you feel about sleep? If it's for the weak, do people say meow when they see you or go to hell? I'm not sure what that means. You can go into OBGYN. And I especially don't know what this means. What are you doing during your free time? Script clubs, go in orthopedics. I've never been to a script club in my life. That would probably be a lie. But if you like driving shiny cars around LA, going to plastic surgery, if you like penis jokes, going to urology. So if you don't know what you want to go into, just kind of use this little chart here. It may help you. So my second year of residency, I was able to go to Port-au-Prince, Haiti with Dr. Wilkins. He's actually a veterinarian and a pediatric orthopedic surgeon. He went to veterinarian school before medical school and decided he didn't want to do it anymore. So he became a pediatric orthopedic surgeon. So I actually went with him twice while I was a resident to do trauma as well as pediatrics. So this is the front of the hospital here. And again, this is these pictures here of these patients that are just laying on floors, laying on cots. You just don't see these things like here in the U.S. It's not as common. This is the operating room here. You can see that they did have an orthopedic surgery residency there and work with the residents, did some teaching. This little kid, we're doing some type of ankle fracture. And then this little kid here had a open fracture, which means the bone was sticking out of the leg. And usually a patient like this, we would take him to surgery probably within the next 24 hours. But this kid most likely didn't have, the opportunity to, have that done. So he ended up getting an infection in his leg. It's called osteomyelitis that we had to debride it. And then we put this little external fixator, which are these little metal bars to kind of keep it out and keep it stable until it heals. This is another anesthesia cart here. And this is kind of where we washed our hands before surgery. So this is the kind of scrub sink. So here in the U.S., before surgeries, we scrub our hands, as you guys know, with the scrub brushes. But over in Haiti, I went to go use the bathroom or grab something to eat. So I caught up with Dr. Wilkins, and he was standing here, and he was scrubbing his hands. And I said, hey, Dr. Wilkins, I can get a scrub brush from? He said, we use the same one here. So yeah, I actually use his scrub brush to scrub my hands too. So that's all they had there. These are some of the injuries that we saw here, lots of femur fractures. And then here in the US, if I got a call from the ER about a patient who had this femur fracture here, this is probably something due to the long oblique kind of nature of this. I would probably put some metal little rods or pins into this and take them to surgery. Well, in Haiti, they don't have that option. So this patient actually stayed in the hospital probably for about 3 months. And then they put some traction on his leg, which means they hang some weight to the end of the bed and just hold it out to length. And then they get x-rays weekly. So versus in the US, I would have fixed this patient probably that same night he came into the ER, and that patient probably would have went home the next morning. So it's a vast difference from, 2 different countries. This is a big cystic lesion in the proximal humerus in a little kid, and a little kid who got shot in the leg here. So this is a little kid that I saw in the ER here. This was a case that really, really touched me, because I saw this little kid in the ER. They called us, said, hey, we have this little kid with a swollen leg. We got some x-rays, and then, they saw this little lesion. They saw this huge lesion here. His eyes were very jaundiced. His hemoglobin was 6.7. He's very anemic. And I knew right away when I saw this, a young kid who is cachectic. He has a lot of muscle wasting. Cachectic means he's very thin, and he's not able to hold food down. So I knew right away that what this gentleman had. Does anybody know what this is?
Rickets?
That's a good choice. But this is actually osteosarcoma. So here in the US, the way we treat this is with preoperative chemotherapy. So we send patients to get chemotherapy before surgery. And then we do the surgery, which will be a large resection, basically cutting the bone up here, getting rid of all of this tumor here, and then sending them to chemotherapy after surgery. But the problem is there's no chemotherapy, there's no oncologist in Haiti. So I knew right away that this sad case, this gentleman would probably, pass away. I'd probably give him, 6 months to a year, being in Haiti versus, being in the US. This is something that, it's definitely treatable, and these patients do quite well. So, and I asked him, because, this gentleman reminded me of my little brother who passed away from leukemia at age 21. I asked him, I said, hey man, are you scared about everything that's going on? And he said, no, I'm not scared. So that really inspired me, and just really touched me, because despite everything that's going on, he had this really morbid diagnosis and was likely going to pass away probably in a few months. I'm not sure if he knew that, but he was very optimistic about it. So it really inspired him and touched me. So this is a little kid here. In the US, we have what's called spica cast tables. A spica cast is when a patient has a femur fracture or a little pelvic fracture, and you put this cast on, you leave it on for a few months or a few weeks, few months. But in Haiti, they don't have those tables. So Dr. Wilkins made me hold this little kid up while he put the cast on him. And you can see the kid, he was not very happy about that. And then Dr. Wilkins, he started this club feet program over there, where we do this casting technique called pancreatic casting. It's like a series of casting to correct patients who have club feet. And we were in clinic, and then just this little kid had club feet here. This is another school that I went to, the School for Deaf and Blind over in Haiti, and it was good just to visit these kids and just spend some time with them. As you guys can see, I love to travel. My 4th year of residency, I was able to go to Bangkok, Thailand. I got an AO, which is the American Academy of Orthopedics Trauma Fellowship. I was there for a month doing orthopedic trauma surgery as well as spine surgery at this hospital here. And they had a residency program too. So, other countries, they do the same thing. They have lectures, they have, they get taught by their staff. These are some of the topics that they were talking about: distal clavicle fractures, tumor biopsy, ankle fractures. And then this was outside of the, right outside the OR here. A lot of the people in Bangkok, they rode these little bikes here, and I thought it was pretty hilarious that, like, wow, this is crazy. All these bikes here, it's kind of comparable to the cars that you see here in the US when the parking lot, the physician's parking lot is very full. So lots of different crazy injuries, a lot of trauma, femur fractures, patients who had spinal stenosis, which is like a tightening of your spinal cord, I did a lot of spine surgery and scoliosis cases while I was there. And this was the operating room here. And I guess this is their tradition. The tradition is to not wear any socks, or they wear these little flip-flops in the operating room. So even the anesthesiologist, you know, he's just sitting there with his shoes off, and he's probably playing like Minecraft or something like that, where we over there just busting our butt and just sweating and putting things back together as surgeons. But, you know, I couldn't leave Thailand without, you know, getting in on this also. So can you guys see which picture is me, which foot is me? Yep, that's me right there. So I thought that was pretty hilarious that, you know, they do that. And, you know, I wasn't going to leave Thailand without at least trying, just going in the operating room with those clogs, whatever they call them. I was able to go scuba diving, and that's my first time doing that. I did that over in Thailand as well, so that was a lot of fun. So for orthopedic surgery, it's 5 years of residency. You can do an additional year of fellowship. 90% of people do a fellowship. So sports medicine, you can spine surgery like myself, which is the best field ever. Pediatrics, oncology, joints, like hip and knee replacements, foot and ankle. And then, but 90% of people do them. There's some people that were above me, maybe 2 years before I graduated, that didn't do a fellowship. You know, they just went to work as an orthopedic surgeon, general orthopedic surgeon, and, you know, you can do that as well. But, you know, doing a fellowship just makes you more marketable. You know, you can hone on one particular skill set. But given the fact that I trained in spine surgery, I still do some general orthopedics. So, you know, I did a knee replacement last week. You know, I do see general orthopedic patients in my clinic. Tomorrow I have a patient who has rotator cuff tears, patients with hip arthritis, carpal tunnel syndrome. So I still see general and treat patients with general orthopedic issues. So orthopedic trauma surgery, 1 year fellowship, you know, you treat injuries like this. This is a tibia fracture that we place this metal rod down the bone. This is a distal radius fracture that we put this metal plate and screws to fix the fracture. Sports medicine, you know, anytime that there's a injury on the field, there are orthopedic surgeons that take care of these injuries. So whether they're non-surgical, like physiatrists who do a sports medicine fellowship, or, you know, you can do a sports medicine fellowship after pediatrics or emergency medicine. But you'll be just doing like the non-surgical things. But when Paul George kind of broke his tibia, the orthopedic surgeons are the people that fixed his fracture. During my rotation, you know, here in San Antonio, we were able to work with the Spurs doctors. So we were able to go to a lot of the games, the playoff games, you know, go into the locker room, you know, examine the players. And then when David Lee, a couple years ago during the playoffs, he supposedly injured himself on a play. We took him back and got some x-rays. There was absolutely nothing wrong with this gentleman. And that's what I have seen, you know, taking care of a lot of athletes over the years, is that, you know, the biggest guys who are like 6'9", 6'10", 280 pounds, you know, they're the biggest wimps. So he was more freaked out than anything else. His x-rays were negative. We examined him, and, you know, he went back into the game. But my friend actually caught me on ESPN, and he took this picture and sent it to me. So I thought that was pretty hilarious during the playoffs. This is Dr. Smith. He's the head team doctor for the Spurs.
Dr. Webb?
Yes.
So we're at the 30-minute mark, and we'd like to stop for a short 10-minute Q&A session, if that's okay with you.
Yep.
All right. So I'm going to read out some questions from the chat. Keep in mind that I'm not going to get to every question, but there will be a longer Q&A at the end. So our first question is it possible to do 2 fellowships at once?
Yeah, actually my co-resident, she did pediatrics first, and then she is in her sports medicine fellowship. So she wants to be a pediatric sports medicine orthopedic surgeon. So you can do 2, you can do 3. Not very common, usually 1. By that time, you want to be done with training. You want to start making money. You know, you don't want to do another year of training. But, you know, if that's something that you want to do, then yeah.
Thank you. Our next question is, do away rotations follow an interview process to get in?
Yeah, most programs, to save you time and money, say for instance, I rotated at Baylor in Houston, Northwestern in Chicago, and UT San Antonio. So I did 3, plus my home program at Georgetown. So I did like 4 or 5 months of straight orthopedics. It was the best thing ever. Yeah, so after like a Chicago, they did give me an interview. You meet with the program director and chairman. So that's one kind of pro of doing away rotation. You get it. It's pretty much a guaranteed interview unless you just go there and just mess up. But most places they understand that you don't have time to like travel all the way back and interview. So they'll try to interview while you're there.
Awesome, thank you. Our next question is, how do you think we can improve medicine in the countries that you've traveled to?
Yeah, that's a difficult question to ask. I think just lots of other organizations that are willing to go over there to give their time and their expertise. Dr. Wilkins has been over there about 50 times in the last 20 years. So he's built a couple different programs, and he has a really good rapport with the hospitals and the residents. So they communicate with him about cases, and before we go over there, we kind of have an idea of what surgeries we'll be doing, and just if there's more people that we're doing that, I think that it's probably not sustainable. Dr. Wilkins is probably in his 70s now. He can't do that forever, but hopefully other people can step up to the plate and just help out wherever they can.
Thank you. Our next question is, can a person apply to 2 different types of residency, such as orthopedics and pediatrics?
Yeah, you can. Some people actually do that for competitive specialties as a backup. So, say for instance, you want to go into dermatology, your scores are not really competitive. You can apply to internal medicine also, and then you just be going on a lot of interviews. You may go on like 20 interviews, 10 for dermatology, 10 for internal medicine. But yeah, you can definitely do that.
Awesome, thank you. Our next question is, have you ever interviewed medical school students?
I have, yep.
So the person is asking, in your opinion, what are some common mistakes that interviewees make besides being nervous?
Yeah, I think it's important to just be yourself. Once you get your foot in the door and get an interview, your chances of matriculating are a lot higher than a person who didn't get an interview. So you just need to just be yourself. You need to know your application inside and out. You need to have a lot of questions to ask. You need to know like why. Say for instance, if you're going to University of Maryland, why University of Maryland? They will ask you like, hey, why do you want to come here versus University of Kentucky or Ohio State University? So you need to research that program and know what's really specific about that program. So I think the students that try to be someone that they think the interviewers want them to be, or the students that are on their phone or they're late, or a lot of inconsistencies between their application and what they're telling you. Those are kind of some red flags that I think.
Thank you. Our next question is, how much does being a healthcare worker add to your medical school application?
It can help, but it doesn't take the place of a low score or a low GPA. I had 8 years medical experience. They didn't care about that. They care about your scores. But some schools do take a holistic approach to reviewing your application, so it can help. It just can't. It won't make up for any low scores or low GPA.
Yeah, thank you. Our next question is, how has your experience as a medic in the military impacted your career as a physician?
Yeah, great question. Being in the military really allowed me to develop leadership skills. It allowed me to be very disciplined, have a rigid schedule. We got up every morning in the military at a certain time, like 4:30, 5 o'clock, and we went running, did physical therapy, physical training. Just that discipline that I learned in the military to be very regimented with my studies and helped me to be successful in medical school. And just working under pressure as well, getting shot at in Iraq while you're trying to take care of patients. You're going to be in a chaotic environment, especially, if you go into general surgery or emergency medicine. In the trauma bay. Trauma bay is a very chaotic place. So, you have to see patients down there and everybody's yelling, patients are yelling, lots of loud noises, just being in the operating room as well, which can be very chaotic. You have to remain calm. If something goes wrong, you don't want to freak out and like, oh my God, you have to be very resilient. And that's what I learned in the military.
Awesome, thank you. Our last question for this Q&A session is, how has being an orthopedic surgeon affected your work-life balance?
That's a good question. So something that I want to leave with everyone tonight is that you can go into whatever field that you want to go into. I would choose a field, something that you're passionate about. A lot of people tend not to choose surgical subspecialties or surgical specialties based off of, oh, I'm gonna be very busy, or I won't have a lifestyle. Well, if you're in private practice, and also depends on your contract type, whether you work for a hospital or whether you work for yourself, but you can make your own schedule. I'm in private practice. If I wanted to take off every Friday and have a 3-day weekend every week, I can do that if I wanted to. If I, like tomorrow, I have clinic, number of different patients that I'll be seeing. If I didn't want to start clinic until 12 and sleep until 9 or 10, I could do that. So a lot of people don't really understand that. The downside is that you take off work, you're going to lose money. And at the end of the day, as long as you can make meet your overhead and pay your employees and pay your office staff and all your overhead, then no one's going to really care. Like, no one's pressuring me to go do surgeries, but I just won't make any money if I don't do surgeries or see patients. So that's what a lot of people really don't understand. You can control your lifestyle. You can be as busy as you want to, or you can be not as busy as you want to, depending on your job type. I'm in private practice. If I worked for a hospital, they would probably pressure me to be busy. Or if I worked for a university, they would probably pressure me to be busy. But that's the reason why I chose private practice. I can do whatever the hell I want to do. So nobody's going to tell me, hey, you need to do 10 surgeries next week. If I want to do one surgery and spend the rest of the time with my family, I can do that. So.
Awesome, thank you so much. So before you proceed, I would just like to say to all the participants, please respect each other's questions. Just because some of these questions can be answered by Google doesn't mean that it's not appropriate to ask. However, I wasn't able to get to all of the questions just because this was a 10-minute session, but please be respectful and be nice to each other. We're all here to learn. And for those of you that I couldn't get to your questions, there will be a longer Q&A session at the end. Dr. Webb, you can continue. Yeah.
Do what she said. All right, so we'll keep going. Sports medicine. These are some pictures of some NFL players. Joint replacement. You wear these spacesuits here to protect us from all the fluids that are flying around in surgery. So if you do a joints fellowship, you can do knee or hip replacements. This other pictures. This is what it looks like inside of a knee replacement. And this is what it looks like after surgery on the x-rays. One of the particular implants that we use. So spine surgery, the best specialty out there. I want everybody to go into spine surgery. It's the best field. So we actually use a lot of different technologies and innovations in spine surgery. And that's the reason why I love it. There's always something new and fascinating that's coming out that can help us perform surgery in a more precise and accurate kind of manner. So this is a robot that we use in surgery. It has a robotic arm here. And then I can place screws like this here in this x-ray down here by telling this robot, hey, go to the right side of the patient at the L2, the second lumbar vertebrae, and then this robotic arm would just move and then go in the right position. Otherwise, you take a lot of x-rays, you have to look at their anatomy. You can put the screws in the wrong place. So, you know, spine surgery is very high risk, but it's very rewarding. This is an O-arm that we use. It's an intraoperative CT scan that we can place instrumentation near the spine. I did a combined neurosurgery, orthopedic spine surgery fellowship. This is one of the neurosurgeons that I worked with in fellowship. We use microscopes in surgery for the very small structures to just help magnify everything. This is another picture of the robots, computer navigation, just using, so this surgeon here is looking at the computer screen. She's putting a screw in the cervical spine here. So navigation, robotics, 3D printing. This is a 3D printed spine here that we use. This is a scoliosis surgery that we just did last week. This patient had a curve just like this. This is their spine, and we use these pedicle guides here to put the pedicle screws in. So this is 3D printed. This is I thought that was pretty cool. Lots of different kind of new and up and coming technology in the field of spine surgery. So coming from Louisiana, where my family members were in prison, I had friends, my cousin who just got out of prison for he was in there for a number of years. How did I get to this point? So I asked this to all the students that I talked to, and the 3 things that I want everyone to take away from this talk is you have to believe in yourself, you have to perfect your craft, and I want you to know that you should never give up. These are some of my favorite quotes, but along this path are going to be people that you're going to tell you that you can't do it, you're not smart enough, you'll never get into med school or dental school or law school, but you just have to dig deep down and tell yourself that you can do it, and you have to constantly tell yourself that. Otherwise, you'll keep doubting yourself. You'll just have second thoughts, and I've had those same thoughts as well. But number one, the most important thing is that you have to believe in yourself. The second thing is to perfect your craft. So I'm a big sports fanatic. Kobe Bryant, Allen Iverson, LeBron James, Michael Jordan, Kevin Durant. These are some of the best basketball players in the world. When you are thinking about going into a certain specialty, or if you want to go to medical school, think about what these guys are doing on a daily basis. Like, what is LeBron James doing right now when you're sitting there playing Call of Duty or whatever, Fortnite? What is LeBron James? He's probably practicing some free throws, or going to work out, or working on his flexibility. Kobe Bryant, after he loses a game or doesn't have a bad game, he's still scored 60 points, and he's hey, I had a bad game. He goes shoot 1,000 free throws, after playing a full game. So have that same mentality, that Mamba mentality, when approaching becoming a doctor. So if my med school classmates read a chapter 3 times or 1 time, I read that same chapter 7 times. If they did 1,000 questions for an exam, I did 7,000 questions. So essentially just outworking everyone else. Even after finishing all of my training this past year, I still study, I still read, I review my anatomy. I'm constantly trying to perfect my craft. I'm going to the cadaver lab here in a few months to work on some surgeries and some exposures, it's life. Medicine is a lifelong learning process, and you have to treat it as such. And then lastly, I think it's important to never give up. One of my professors in medical school stated that failure is not in the falling down, it's in the failure to get back up and try again. So I failed many times throughout my life, failed tests, I struggled with standardized test taking. The first time I took the MCAT, this is on the old MCAT scale, I made a 17. I actually made a 16. My score on the verbal section was a 3. So I don't know how that is possible. I got 1 point for kind of each, part of the verbal section, but that's the lowest you can score, 3. My total score was like a 16. So I was completely lost. I didn't know about the MCAT until I had already graduated college and one of my classmates at UTSA, and he was like, hey, I'm going on some interviews. I was like, what? You already applied to medical school? That's crazy. So I was so lost, and that's the reason why I'm so passionate about helping students get to the point where I'm at today. So I didn't have like YouTube to go on and watch some videos of like Dr. Webb filming in his car, or walking around the hospital looking like a weirdo with a camera. So but you guys have that, so definitely take advantage of that. What not to do? There's his name is, they called him Dr. Love, but he's not actually a doctor. He didn't ever go to medical school, but he was this gentleman in Florida. He opened up his own medical practice and was seeing patients. He had all this staff. The news stations interviewed him, and he said, hey, welcome to New Life New Birth Center, or something like that. And I was like, holy crap. So someone said he looked like me, and I had to recreate the pose here. I don't think this gentleman looks like me. What do you guys think? But his name is Dr. Love. He's out in Florida. He actually went to prison for this, for faking being a doctor. But don't do that. Just go to medical school. This is to contact me. All of my social media, Facebook, Twitter, YouTube, Instagram, Antonio Webb MD. It's my website. Make sure you guys follow me on all of these here. Connect with me. And any questions, just shoot them my way. But I'll take some questions now.
All right, everyone, send your questions in, and I'll be calling them out. Dr. Webb, our first question is, did you do HPSP or a similar program?
No, I decided I didn't want to go back in the military for a number of different reasons. I didn't want to get deployed again. I didn't have a family. I have a family now. Just been away from your family for 6 months at a time. That's pretty hard. I was in for 8 years. I decided it wasn't best for me, and I calculated how much student debt I would have and how quickly I can pay it back. You have to think about the tuition when you're looking at medical schools and how much the tuition will be. You don't want to come out of medical school with $500,000 in debt like I did. I went to a very expensive medical school. If I could have done it all over, I would have maybe, I don't know, that's kind of a hard decision versus taking an acceptance at a very prestigious medical school and pay all that tuition versus applying again and hoping that you can get into a cheaper school. So I took the gamble and went with medical school at Georgetown. And but the pay difference is, it doesn't even come close. You can probably make 8 times, 9 times, 10 times as much as you're getting paid in the military that you can make in private practice. But there's a lot of different pros and cons to it. They pay for your health insurance. You have your school paid for. You get the stipend while you're going to school. So, but you have to figure out what's best for you and your family.
Thank you. Our next question is, did you ever experience imposter syndrome? And if you did, how did you overcome it?
Yeah, so imposter syndrome is it's very common. It's just not a lot of people talk about it, but yes, absolutely. When you're in high school, you have some people there that are smart, but you have some people there that they're just there because their parents make them go to high school. If they can drop out, they probably drop out. In college, it's very similar. You have a little bit more smarter people, but at the same time, you have people that are just there because their parents say, hey, you got to go to college. I'm not going to pay for your school if you don't go, and blah, blah, blah. But when you get to medical school, everyone is freaking smart. You have some of the most intelligent people that you will ever meet, and you're competing with these individuals. So for me, coming from Louisiana, where no one in my family was a doctor, I had never met a doctor before in my life, especially a Black doctor. That was a big change for me. And I always have these doubts in my head, like, wow, what am I doing here? Am I smart enough? Can I actually do this? So, you have those thoughts in your head, but you have to just trust the process. There's people above you that have went through this process before, and I always use them as inspiration and say, hey, if they can go through, get through everything, I can also. So if anyone on this call has, any self-doubt, or they feel like they don't belong, or, they feel like they're not smart enough, everyone has those feelings at some point. And those feelings are completely normal. I've had those feelings kind of all throughout this process. Sometimes I still do, and I walk into the doctor's lounge and no one else looks like me. So you just have to trust the process and keep telling yourself that, that you can do it. And, people before you did it, you can do it also.
Awesome, thank you. Our next question is, what specialties would you say make it hard, and which ones make it easy to balance work and family life?
Yeah, so every residency program is going to be hard. So don't choose a specialty based off of how hard you think the residency program. I almost fell for that. I was like, hey, I'm going to go into emergency medicine, do my 3 years, get out, start making money. But I would have probably hated my life. Some people like emergency medicine. I just figured out it wasn't for me. So you have to figure out what you're passionate about. But the busier specialties are going to be the surgical specialties. But like I said, in private practice, I can do one surgery a month and I just won't make any money or pay my overhead. But you have control over your lifestyle once you're, like, if you're in private practice. If you're an employee working for a hospital, or if you're working at an academic center, it may be a little bit different. But the busier specialties, OBGYN, plastic surgery, neurosurgery, orthopedic surgery, ENT, those are the busier subspecialties.
Thank you. Our next question is, what is your favorite surgical procedure and why?
I love spine surgery just because it keeps you on your toes. You can never have a bad day. We're putting in instrumentation and hardware, screws within millimeters of the spinal cord or the vertebral artery or, the aorta. So if you put your screw in too far, or if you slip your hand, you're going to put a screw or some type of instrument in the patient's aorta, and they can die. So it's very high risk. It's very rewarding, though. I had a patient last week who came to my clinic on Friday. He was in excruciating pain. He was like crying in my office. He was in a wheelchair. He had fell like a few weeks before that. And he was like, please, doctor, do something for me. And I was like, crap, it's like Friday afternoon. It always happens that way. It's like the last patient on Friday at 5 o'clock. So I ended up admitting him to the hospital and saw him over the weekend, this past weekend, and Sunday night he was still in a lot of pain. So I took him to surgery Monday morning and did a procedure. And the next day he's like, thanked me. He wanted to like give me a hug, and he had no pain. He was walking around with physical therapy. So any surgery in spine surgery is kind of my favorite, but patients like that it's very gratifying to see stuff like that, and like, hey, you changed my life. Gave me a new kind of life. So, but I especially enjoy anterior cervical surgery. So going through the neck here, doing a fusion or an artificial disc replacement. I enjoy robotics surgery, computer navigation. So those are my favorites.
Thank you. Our next question is, how do you approach ethical dilemmas in the healthcare setting?
You talk with your colleagues. There's a lot of things that you have to conversate, and I talk to a lot of my co-fellows. If there's something that you're unsure about, that there is a medical ethics office at the hospital that you can get involved in. You have some dilemma, like patient comes in and they have a really mangled extremity, and I'm trying to decide whether I want to take them to surgery, cut off their leg or not. That's a really controversial kind of thing in surgery. So, you get the medical ethics team involved and talk to your colleagues, talk to your mentors, do things like that.
Thank you. Our next question is opening up a private practice a long process for someone that has no business background?
Yep, very long. It's very challenging. I mean, they don't teach you the business aspect of medicine. I mean, it's you find out things, you read books, talk to people. You just, one of those things that you have mentors, but it can be very challenging to do that.
Thank you. Our next question is, can you speak to the number of females in your field?
Yeah, females and minorities are underrepresented sit in orthopedic surgery, especially spine surgery. But I know a lot of females that are orthopedic surgeons. I know a lot of females that are orthopedic spine surgeons. But the numbers are really low, especially for minorities in orthopedic surgery. It's less than, or Black orthopedic surgeons is less than 1.5%, or probably even lower than that for spine surgery. So there's a lot of women in orthopedics. It's just not enough. We need more women. So if you're interested in it, I would say do some shadowing, look into it a little bit more. We definitely need more women in orthopedics.
Thank you. Our next question is, have you encountered any seriously difficult cases?
Oh yeah, all the time. Yeah, I mean.
Can you describe one of them?
I mean, every case can be difficult. No patient's the same. You're utilizing what you learned in your surgical skill set to come up with a plan and take care of a patient. So during your residency training, you do a lot of surgeries. I did over 2,000 surgeries during my residency. So you see from complex injuries. I did surgery, as you guys saw, kind of all overseas. So a lot of difficult cases. You just have to keep studying, and after each surgery, I ask myself, like, hey, what can I do to improve? The surgery yesterday that I did, I review my surgical notes, and I critique myself and analyze, look at the x-rays, see how the patient's doing. What could I have done differently? What medication, or maybe I could have done it a lot quicker, or vice versa. So yeah, I mean, every surgery is difficult. You just you prepare for it, and you plan for it, and you'll be fine. But every surgery can have some type of complexity to it.
Thank you. Our next question is, given the circumstances of the pandemic, how has your approach to patients changed?
It hasn't really changed much for me. I still take care of patients. Patients are going to still have back pain, neck pain, leg pain, break their hip, fall and break their arm. My approach really hasn't changed any at all.
Thank you. Our next question is, do you know any programs that are offered to pre-meds that could be beneficial for orthopedics?
If you're a medical student, there's a couple. There's the NTH dimensions, NTH dimensions. Outside of that, I can't think of anything on top of my head, but yeah, most schools have like an interest group. So plastic surgery interest group, dermatology interest group, get involved with those, especially even as a undergrad. You can, if there's a medical school that's close to you, see if you can get involved with those programs and then meet people, make connections. That's probably the best way. I can't think of any others kind of off the top of my head though.
Thank you. Our next question is, in your opinion, what is something that you would like to change about our current healthcare system?
I would say probably access to care. There are a lot of patients that go, with certain conditions that go untreated because they can't get into a doctor, or, growing up, people that couldn't go to the doctor because they didn't have health insurance. So you see that a lot kind of in kind of disadvantaged communities, kind of the social determinants of health. All those things kind of come into play, but I would probably say access to care, as well as kind of eliminating the competition within insurance companies. There's always a battle kind of back and forth. I'm always on the phone with the insurance companies trying to get approval for patients, like an MRI. I ordered an MRI of a patient's neck. I had to do a phone call with the insurance company to explain my reasonings for wanting an MRI, which is freaking ridiculous. I don't have time to do that. So the competition within insurance companies, the politics within medicine, those things.
Awesome. So our last question is, have you ever made a decision regarding a patient's case that you regret?
I can't think of any particular ones, but you know, as a trauma, you know, chief resident, you're making a lot of the decisions. So usually there's a team of us at the hospital, like a 5th year, 4th year, 3rd year, a couple interns, and then you know that they're seeing those patients, and then they call you, hey, I got this patient with this open femur fracture down in the trauma bay, he has a head injury. He's acidotic, you know, has all these other things going on. And then I have to make a decision. Hey, do I want to take this patient to surgery, or do I want to make sure they're taken up to the ICU to get taken care of for a little bit to stabilize them? So probably that the decision making, I can't think of a particular kind of time, but that decision making of like, when should I take a patient to surgery, or what surgery should I do? There's million ways to skin a cat, especially in spine surgery, and you know, you're always critiquing like, hey, what can I have done differently, talking to your mentors and just trying to improve and better yourself as a physician and clinician. So I can't think of any particular case, but you know, you're always self critiquing yourself and what could I have done differently with this patient. That's why it's called practicing medicine. You're actually practicing. So
All right, thank you guys, and it was nice having all of your questions. Thank you, Dr. Webb, for speaking with us. We had a lot of people from all over the world excited to hear you, so we're glad to have you today. Unfortunately, since we do not have unlimited time, we won't be able to reach out to all questions. However, Dr. Webb's email and Instagram is on the slide there. So
yeah.
y'all, and his YouTube channel. Definitely
check out this. You know, any of the specialties that you want to go into, cardiothoracic, family medicine, paramedic. I'm interviewing a forensic pathologist this week. I have a dermatologist day in the life coming up, lots of other videos. So definitely check out, you know, YouTube. I want all of you guys to follow me on Instagram, and you know, I try to post some things about my day. Any questions, just comment or send me a message, DM. But this is, I hope to connect with you guys through social media.
Yep, so then y'all have any further questions, you can reach out to Dr. Webb that way. And also, so at the pre-med team, we're offering like virtual shadowing, like the session we had last time with Dr. Jonathan and now with Dr. Webb. And we'll be soon offering mentorship programs and other opportunities, so please stay tuned to our platforms. And thank you so much again, Dr. Webb, for having you. And Snehal will be talking about the quiz we have over this session.
All right, you guys take care. Have a good night.
Thank you, Dr. Webb.
Thank you, Dr. Webb. The pre-med team has created a quiz. So you'll just have to take this quiz, and if you pass it with a 60, we'll send a certificate to your email. And yeah, we'll just send it.
Saturday at 11:59 p.m. on Saturday. The recording will go up somewhere around tomorrow. We'll notify y'all in the GroupMe. Also, the quiz should be sent soon in the chat here, but we'll also send it as a follow-up in our GroupMe. So please make sure you're on those platforms.
Thank you all so much for attending today's session. We really appreciate your participation, and we hope that you enjoyed it and that you will join us next time for our next session. Once again, the quiz link is in the chat. And if you face any issues or have any questions, just let us know on the GroupMe, or you can send us an email. Thank y'all once again, and have a good night.
Thank y'all.